Hello friends, in this video we are going to talk about very serious talk about the part of the skull, fetal skull, the presentation of the skull and the various diameter of the fetal skull. We talk about fetus here. Now, these parts are very important in understanding the mechanism of the labor. Now, let's talk about one by one. When we talk about presenting part means the part of the skull that is just above the internal os of the uterus. We will see these things in our further labor videos, but right now you need to understand the thing that the part of this fetal skull, for example, this is vertex. For example, this is vertex part. Vertex is here. This is the vertex. Sorry. This is the brow. This is the vertex. This is the occiput. This is the face. All these kind of parts are very important at the time of labor, which are just above the internal os, because this part will further direct the pathway of the labor. For example, if we start with different various parts of the fetus, let's start with this. This part, just concentrate on this thing. This is the frontal bones, this part. Okay, this is the bregma. There is anterior frontinelli, this is posterior frontinelli, this is the sagittal suture, these are both are the parietal bones, this is parietal eminences, this is the coronal sutures. So this part makes the vertex, so called vertex. Vertex is a rectangular area of the skull which is bounded anteriorly by anterior frontinelli, posteriorly by posterior frontinelli, laterally imaginary lines are there in the parietal, just medial to the parietal eminence. Anteriorly it's also bound by the coronal sutures, and here the lambdoid sutures. Okay, so this very part is called vertex. You understand? We are going further. We are seeing the part that is called brow. If we see the skull like this part is called brow. See, this part. The particular this part is called brow part. And when this part is present as a presenting part, it is called brow presentation. The boundaries of the brow part are anterior frontinelli. Here is the base of nose and supraorbital ridges. Here are the supraorbital ridges. Coronal sutures, frontal suture. This very part is called brow part. Okay, and the brow presentation is again among the some common presentations. Now, another thing I want to emphasize is face presentation. This part is called face part. It starts with here. Let's see. This is the supraorbital ridges. Okay, and here is the base of the nose. Here The mandible we have missed here. Suppose here is the mandible, this one. So this particular part is called face presentation part. Okay, so you need to understand this thing very clearly. We have discussed three parts: vertex, brow, and face. This is vertex, this is brow, and this is face. Again, vertex, brow, and face. These three presentations are common. Now I need to identify some of the points which are very important in fetal skull. If we talk about this this particular point, it is called sinciput. Okay, this is sinciput. This is, see here, this is called vertex, sorry, occiput. This particular point of the fetal skull is called occiput, and below occiput it is called sub occiput. This is occiput, this is sub occiput. Okay, let's go in front of the thing. Here we don't have a mandible shown here, but we have to imagine a mandible here. For example, this mandible is like this. Okay, so this part is called vertex, and just behind the vertex there is a part called, oh my god, I'm sorry, this part is called mentum, and just behind the mentum it is called submentum. I will show you in the lateral picture here. For example, here this is the mandible we have here. So this is mentum and this is submentum. Similarly, this is occiput, but this is subocciput. This is sinciput. Okay, so you need to remember this kind of parts in the fetal skull. Now let's go by the diameters of the fetal skull. There are two diameters of fetal skull. One is anterior posterior diameter. Anterior posterior diameter works like this, here to here. This is anterior posterior diameter, and this is transverse diameter. Okay, this is anterior posterior and this is transverse diameter. Now there are various anterior posterior diameters according to the position of the head, whether it is completely flexed, completely extended, or partial extended. We have three different kind of presentations of the fetal skull, and according to them we have engaging diameter of the fetal skull. Engaging anterior posterior diameter. We are talking about anterior posterior diameter here. Let's see. Anterior posterior diameter can be really very easily seen on the lateral view. Let's go for there. This is now, my friends, the lateral view. Now I will show you the imaginary mandible here. This. Now let's do the one by one part. You need to understand one thing very clearly. When the head engages into the pelvis, what we see is, we see the presenting part. The presenting part is just like 90 degree to the engaging diameter. Okay, so just remember this thing. We will see it further. Now see, the most common engagement part is the vertex. We know this thing. This is vertex. In the, if the head is very flexed in the labor, complete flexion is there, the diameter, the engaging part will be the vertex part, and the diameter of engagement will be suboccipito-brachmatic. Suboccipito-brachmatic. So suboccipito-brachmatic diameter is engaged when there is a complete flexion and vertex as a presenting part. It's around 9.5 centimeter. Friends, this part. So if you can see here, what is the movement of the head during the pregnancy, during the labor? See here, my friends, this is the movement of the pregnancy. This, the head will go like this, and that's why the engaging diameter will be 90 degree to this movement of the skull. So what you need to understand here is this thing, that the suboccipito-brachmatic is the very, actually very good diameter of 9.5 centimeter that happens in the vertex position in if the head is a completely flexed. Now what happens in the bro presentation? This is, my friend, a bro presentation. I'm sorry. Okay, this is bro presentation, this one in pink color. And in bro presentation, your engaging diameter will be mento vertical. Your engagement diameter will be this is the measure in the mandible, and the diameter in bro presentation will be mento vertical. This one, mento vertical, that will be 14 centimeter. So mento vertical diameter will be present while the head will be partially extended. When the head is partially extended, the mento vertical diameter will work, this one, that is 14 centimeter, and the presenting part will be bro presentation. Okay, now the third very common presentation is face presentation. When there will be the face presentation, this, my friend, is a part of face. In the face presentation, you will get the diameter, two diameter of engagement, anterior posterior diameter you will get. The first one will be submento brachmatic, and the other will be submento vertical. Sorry, yes, submento vertical, this diameter. Okay, so you see here what is happening is here, if there is a face presentation, the engaging diameter will be two. One will be submento brachmatic. This is, my friend, submento brachmatic, and that diameter is of 9.5 centimeter. It happens in when there is a mento anterior position. Okay, if the position is mento posterior, the engaging diameter will be submento vertical, this one, submento vertical, and this is around 11.5 centimeter. So my friends, in anterior posterior diameter, you need to uh, 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 remember are generally 4 diameters and 3 presentations. One presentation, the very common presentation, is what your vertex presentation. In vertex presentation, your presenting part will be the vertex. The engaging diameter will be the suboccipitobregmatic, and that is 9.5 centimeter. Second presentation will be brow presentation. In brow presentation, you will have the engaging diameter will be mento-vertical, that is very big diameter of 14 centimeter. So brow presentation, with the brow presentation, the head cannot just normal deliver, because the 14 centimeter is a very big diameter, and in the pelvis 14 centimeter anteroposterior diameter is just about not available at all. So what happens here is the head cannot just pass through the pelvis. So when there is a brow presentation, actually there will be higher grade of CPD, and you need to do cesarean section. You should not wait for the further for the labor. Okay, it happens when the head is not well flexed. It is just a partial extended head. It happens in the partial extended head. Okay, now the third presentation we have is face presentation. In face presentation, the engaging or the presenting part will be the face, and the engaging diameters, anterior posterior diameters, will be 2 diameters depending on the position of the mentum, whether it is anterior or posterior. If the mentum is anterior, then the engaging diameter will be submentobregmatic, this one. This is also 9.5 centimeter, and this is okay. The head can pass it fast from the pelvis. And another diameter in mento posterior position will be submento vertical, and this diameter is also about 11.5 centimeter. That is also not very good diameter. So mento anterior position will be delivered, and mento posterior position will not be delivered. Mento posterior position will be very hard to get delivered by normal delivery. So you need to one thing remember, that mento anterior position is good, mento posterior position is not good. You need to remember 4 diameters. Again I am telling: suboccipitobregmatic, that is 9.5 centimeter, mento vertical, that is 14 centimeter, submentobregmatic, that is again 9.5 centimeter, and submento vertical, that is again 11.5 centimeter. These are the diameters of the pelvis. Anterior posterior diameters of the skull. Now we are going to do the transverse diameter of the pelvis, fetal skull. In that thing, we need to see the head from above. Here friends, this is both parietal bones, and this makes the biparietal diameter, BPD, of the pelvis, of the skull, and that is 9.5 centimeter biparietal diameter, which is the highest diameter, which is a more which is the biggest diameter is biparietal diameter, that is 9.5 centimeters. Again, if you see bitemporal diameter, it is 1 centimeter smaller, 1.5 centimeter smaller. If you want to see this, then you have to see it bilaterally. Let's do it. This is, my friends, parietal diameter. You know this thing, no? This is parietal bone. This is temporal bone here. So bitemporal diameter, if we see from the here line, from the inferior of the fetal skull, this, my friend, will be the bitemporal diameter, and bitemporal diameter is 8 centimeter. The smallest diameter is bimastoid diameter. This one here is the mastoid bone, here is the mastoid bone. it is again smaller, and that is 7.5 centimeter. The bimastoid diameter is the smallest diameter of the fetal skull, that is 7.5. So these are the transverse diameter of the pelvis. We just remember total 7 diameters. In anterior posterior diameter we see 4 diameter to be remembered, and in transverse diameter we just remember 3 of them: bitemporal, biparietal, and bimastoid. Okay, thank you friend, thank you for the very patience you have, because this topic is very that kind of we have to learn this topic multiple times, and if you need to remember all these things, you will just not remember all the thing. You need to prioritize the thing that you need to remember. The things in this video I have shown, this thing only you need to remember, other thing you can forget. Just remember these things and you will be okay with that. Thank you.